the bone length, right? So in that we have divided the parts into above knee and below knee part. One is the total measurement of the bones and second is the segmental measurement. In the total measurement of the bones, we are going to select two landmarks. One is the ASIS here, which is palpated on both the sides. So ASIS is the first landmark. The second landmark here is the lateral. So we are going to put our measure tape over the first landmark. Then we are going to go towards the second landmark. Whatever the measurement we have seen over here, we are going to mark it for the right lower extremity. The same way we are going to measure it from the ASIS of the opposite side and the lateral Melleolus of the left lower limb. And we are going to compare this measurement to see whether there is an actual change in the limb length or not. So this is the first method of total measurement for the true limb length discrepancy. In the segmental measurement, we are going to divide the parts into above knee and below knee. So in the above knee, we are going to measure the length of femur. In the femur also, we are going to divide it into supratrochlear and infratrochlear. That means above the greater trochanter and below the greater trochanter. So for the above the greater trochanter measurements, we are going to take two landmarks. One is again the ASIS and second is the protuberance of GT. Okay. So these are the two landmarks. Again, we are going to put the measure tape over the first landmark, and wherever you have palpated the GT, you are going to put the second mark there. To palpate the GT, what you can do is you can ask the patient to flex the limb and then adapt. Whatever the highest point of the bone which you feel, that is your greater trochanter. So this is the way to palpate GT. So the same way as you have measured on the right side, you are again going to measure it on the left side, same way from the ASIS to GT, and you are going to compare those two measurements for supratrochanteric length of the bone. Now coming to the infratrochanteric, that is the shaft of the femur measurement. For that you have first landmark as GT and the second landmark as lateral joint line. Now knee joint lateral line is when you are going to ask the patient to flex knee a little bit and then you are going to palpate it thoroughly from below to above or above to below, wherever you feel the gap. Okay, this is the heart structure. At one point you are going to feel the gap, then again the heart structure. That gap is your joint line. So on the lateral side it is lateral joint line. The same gap on the medial side is called as medial joint line. So this is the lateral joint line. This is our second point. First point is GT. We know that how to palpate the GT. So we are going to put the mark over the first landmark and then over the second landmark. Okay. So this is the measurement for the shaft of the femur or infratrochanteric part of the above knee measurement. Okay. The same way we are going to measure it on the opposite side, and then we are going to compare both the sides to see whether the bone is shorter or not. Now coming for the below knee measurement. In the below knee measurement, what we are going to do is we are going to consider the medial joint line of the knee as in first point and the medial malleolus as in second point. So as we know that we are going to ask the patient to flex the knee a little bit, and again we are going to palpate above to below or below to above. Wherever you feel the gap, there you are going to put the first mark as a medial joint line, and the second mark is at the medial malleolus. This is the measurement on the left side. Same way I am going to palpate the medial joint line, medial malleolus, and going to measure on the opposite side. So whatever the measurement we are going to take, we are going to note it, and we are going to compare it whether the tibia is shorter on any one side or not. Okay. Now let's learn about the apparent LLD, means measurement of the apparent limb length discrepancy. We know that the apparent one is not due to the bone shortening, it is due to either any of the muscles tightness, weakness, or any joints stiffness. So to measure that, you are going to select any of the midpoint. either be at the umbilicus, second is the xiphisternum, or third is the jugular notch. So any one of the midline point you are going to consider. Here we are considering the umbilicus as a midpoint, and then the second point to be considered is medial Melleolus. Okay, so I am putting my first point of the tape at the umbilicus and second point at the medial Melleolus. So here you are going to consider the proper placement of the tape, that it doesn't, due to placement of the tape, it should not give you any of the discrepancy. So clothing needs to be taken care while you are measuring for the apparent or true length discrepancy. This is for the left side. Then for the right side, again the first point umbilicus and the second point medial Melleolus of the right side. Here also I am making it sure that it is passing through the medial knee joint line and then it is reaching to the medial Melleolus. So this is how you are going to measure, and then you are going to compare both the measurements to come to know whether apparent shortening is there or not. But while measuring this, you are not going to square the pelvis, because whatever the position is, the shortening is due to any of the muscular tightness or weakness. If you are going to square the pelvis, then you won't be coming to know that what is the apparent shortening present or not. Okay. For measuring the femoral length, you can use a test called Galeazzi sign. For that, you are going to ask the patient to flex both the limbs, hip and knee, 90 degrees flexed. Now, flexing both the knees, you are going to see the level of the knee. Okay. So, if at all one femur is longer than the other, what will happen? That side of the knee is going to get lower. So suppose the right side femur is longer, I am just putting it ahead to show you that if the femur is going to be longer in the length, then what will happen? The height of this knee compared to that, the height of the longer femur knee is lower than this height. So that will tell you that this femur is longer than, the right femur is longer than the left one. So by comparing the level of the knees with this test, you can come to know whether there is any true change in the femoral length present or not. Now, to measure the length of the tibia, another method is the prone test, prone knee bend test. In that, what we are going to do, we are going to ask the patient to lie down in a prone position. Then we are going to bend both the knees to 90 degrees, and then the examiner is going to put both the thumbs over the sole of the foot, here, over the sole of the foot, just in front of the heels. And then visually I am going to see that whether any of my thumb is higher or lower. Okay, here the length is equal. So you can see from there that both the thumbs of mine are at the same level. If suppose, just higher this side, if suppose one side of the tibia is higher, I am apparently doing it, she is just taking the hip into extension to show you that if at all one tibia is longer than the other, this is what will happen, that the one thumb is going to be higher than the other. And this is the another way by which you can come to know whether the tibia is longer or shorter than the opposite side. In the treatment, we have to consider certain points. What is the skeletal maturity for the person or the patient with whom you are dealing with? If at all it is a child, then you need to consider the skeletal age, because there is a potential for the growth. So treatment is going to differ whether it is a child or an adult. Okay, because we all know that the bone is going to grow from the epiphysis, and there are certain procedures which are selectively done for the children who are having the possibility of the growth further. So the treatment is going to divide accordingly. Now, if we want to know that what are the possible treatment, it starts from shoe insert, then going forward to the shoe raise, shoe sole raise, and then going to the surgical procedure. So these are the three methods which we use, and in that the shoe raise or shoe insert and the shoe lift or the shoe sole raise is the one which is considered in a non-surgical method of treating the length discrepancy. And in the surgical method, we have two options. Either we have the possibility of shortening of the longer side, or we have the possibility of lengthening the shorter side. Okay, so now let's want to know that how we are going to decide which one treatment option to opt for specific patient. Now, first thing to be considered is how much is the shortening. That is the another criteria which you are going to look forward. If at all your shortening is 0 to 20 mm, that is take care of that minimal amount of limb length discrepancy. Now, if at all the shortening is 20 to 60 mm or 2 to 6 cm, then you have two options. One is the shoe lift, which is majorly used for adults preferably. In the children also it is used, but in the children we have another surgical option here of epiphysiodesis. That means the epiphysis which we have, they are going to staple it, and because of that, of the longer side epiphysis, they are going to staple it. So it is a method called as for shortening. That means on the longer side you are clipping the epiphysis, not allowing the further growth on the longer side, so that further on you are going to have equal length of both the sides of the bone. Okay, so that is the second option. Now, if at all the shortening is from 60 to 200 mm, that means 6 to 20 centimeters, then preferable methods are the surgical methods, in that the lengthening methods are used, or else the prosthetic fitting. That means they will ampute that part and give a proper prosthetic fitting for that much longer difference in the limb. Okay. So now coming to the lengthening method. Which are the lengthening method? The shortened side, they are going to do a cortical osteotomy. That means they are going to cut the bone, and then they are going to give some external fixation device. One of the examples for that is the ilizarov. You can search and have a picture of that ilizarov. You will come to know that what they do exactly. They cut the bone. They have the external device which has certain rings and rods which are externally present, and the screws which are going inside, and both the ends of the bone they have put apart. So, and they have given a longitudinal traction force, which will allow for the osteoblast to grow and fill up that gap. And for that, the lengthening rate or the bone growth rate is 1 mm per day. So the patient has to carry that external device with them for the longer period of time to get whatever amount of the shortening we have, which is minimally 60 mm and 6 centimeters. So it will take longer period of time to go for the lengthening. That is the last resort when we have too much limb length discrepancy. The lengthening procedures are used.